Medical professionals in Massachusetts can resume some operations as part of the first step of Massachusetts reopening following coronavirus shutdowns. Since mid-March, doctors have been limited to seeing patients only for care that could not be delayed, such as emergency dental work, fracture care and treatment of serious medical conditions. Now, hospitals and community health centers have been given the okay from the state to resume a limited set of in-person preventative, diagnostic and treatment services. Hospitals and community health centers must meet capacity criteria and increased public health and safety standards before being allowed to increase services offered. Included services are urgent procedures which if delayed could lead to significant worsening of a patient's condition. At least 30% of intensive care units and 30% of total hospital beds must remain available as part of the reopening plan. Starting Monday, May 25, primary care physicians, dentists and other health care providers will be allowed to resume some operations. Services that may be performed in doctors' offices will include high-priority preventative services such as care for high-risk patients with chronic diseases, immunizations and pediatric care. State health leaders continue to urge the use of telemedicine whenever possible to limit in-person contact. In some fields of medicine, social distancing is not possible. On a typical day before the shutdowns, Dr. Janice Moriarty, a family and cosmetic dentist in Winchester and the president of the Massachusetts Dental Society, expected to see at least 6 of her 7 treatment rooms filled throughout the day. Now, she's prepared to have 1 patient in office at a time, with the support of a single assistant and front office staffer daily. Speaking prior to Monday's announcement, Moriarty envisioned patients waiting for their appointments outside their doctor's office rather than in the waiting room and receiving a phone call when they may enter the office. With social distancing not a viable option for dental treatments, she and thousands of dentists across the state are preparing to wear additional protective equipment during appointments, not only masks and gloves but also goggles and/or face shields. With the limited capacity of doctors' offices, Moriarty and other health leaders across the state fear likely closures of doctors' offices amid and following the shutdowns, leading to a decreased number of medical professionals practicing in the state. "I think about rural practices," Moriarty said. "Some older dentists who maybe are close to retirement and decide to close." In a national survey, dentists reported that if the closures went until August, the majority said they could not sustain the cost of the closures, which have cost practices hundreds of thousands of dollars so far.